Good morning and welcome to For the Love of You. We're super excited here today. We have Hannah Jackman and Jessica McMorty that are speech pathologists from MMI who currently work at Nebraska Med helping stroke patients. Good morning, ladies.
Good morning.
Thanks for having us.
Yes, thank you for coming.
Yeah.
We're super excited to have you on the series for us and excited what we have to learn from you today. So, can you describe your guys' role and kind of what you do, not only just maybe in the hospital, but what happens maybe later on down the road once a patient leaves?
Yeah, so our main role in the hospital is we evaluate speech, language, swallowing, and cognition. We typically follow a patient throughout their hospital stay, especially if they've had a stroke. Once they discharge from the hospital, sometimes they return and see us as outpatients for us to continue to treat their deficits.
Can you explain maybe what cognition is for viewers that maybe don't know?
Yeah, so cognition involves attention, memory, problem solving, executive function, just really things that help people get through their daily lives, help them go back to work and be able to think through the things they do at work. Do you have anything to add?
What would be something, for example, that you would do to test that?
Yeah. So we have screening tools. We have something called a SLUMS. We have a MOCA. And we just go through an evaluation that tests orientation. So we ask questions, what year it is, where are you at? And then we test like delayed recall. So we might give 5 words, have the patient do a couple activities, and then try to remember those 5 words. We'll do simple math problems to see how people could go back to living and going to the grocery store and paying and making sure that they have the right change back, different things like that.
That's a really helpful thing once you get back out in the community that you need to know. So after having a stroke, why do people have trouble speaking?
So the most common thing we see after a stroke is something called aphasia. Someone could have expressive aphasia. They could also have something called receptive aphasia. Expressive aphasia is when you have difficulty communicating your wants and needs, either verbally or through writing. So some people have just where they have difficulty coming up with their words when they're speaking. Some people have both. They have difficulty writing to communicate as well as speaking verbally. The receptive side is understanding, so understanding what people are saying to you. They might go off on these long tangents where they're talking, but they really didn't understand the question that was asked.
Great, thank you. So you kind of described what aphasia was. Is that the only issue that can happen with speech when you have a stroke?
Yeah, so the other things that we see is something called dysarthria, which is called slurred speech. A lot of times that's due to oral weakness, so weakness in their mouths with their tongues or their lips or their cheeks. It's hard to know all those things really contribute to your speech. Another thing that we see is something called apraxia of speech. Apraxia of speech is the motor planning, so your brain telling your tongue or your lips or your cheeks where to go. So those are the 2 major things with speech that we see.
So are there different, I'm sure there's lots of techniques, but is there an example of a technique that you could, how do you help aphasia, and then how do you help dysphagia?
Yeah, so the way that we help aphasia is we have people circumlocute, which means they talk around what they're trying to say, they describe it, they maybe say what color it is, things like that, so that their communication partner can maybe help assist in coming up with the words that they want to say or understand what they're saying.
And that's probably something that everyone can relate to. Happens once in a while where the word just isn't coming to you. But for these people, it happens all the time.
Yeah. And then for people that have slurred speech, what we say is really over-articulate, really try to hit those sounds hard. Some people don't really like doing that because they feel like they are slowing their speech down, but it really helps their communication partner understand what they're trying to say.
Sure. And I'm sure both can be really frustrating, but that aphasia probably is really frustrating for that person. I know personally when I can't get the word out, I get annoyed with myself. So having that issue all the time probably can be frustrating. Is there helpful hints that we can tell their caregiver or their communication partner, anything we can helpful hint, to help that frustration decrease?
Yeah. The number one thing that we say is don't talk for your loved one. We still want them to be able to say what they want to say versus someone else speaking for them. Give them time, extra wait time, and if they are really struggling, maybe asking yes/no questions, to see if there are ways that you can help facilitate that communication if you are seeing that frustration.
I know sometimes with the wait time, it seems like you're waiting a really long time because typically we give each other feedback immediately. So sometimes I'll even just look at the second hand on a clock and it's only been 5 seconds and, you know, they'll answer me maybe within 10 seconds, but it feels a lot longer than that to us
Sure.
because we're not even used to waiting a few seconds for a response.
Right, right. No, those are great, helpful hints. When you have a stroke, why do you have difficulty swallowing?
So difficulty swallowing comes based on the part of the brain that's affected from the stroke. And so we typically see this is usually shown when people are coughing or choking when they're trying to eat or drink. And we can see that at bedside, but sometimes we need to do a study to look at that further and assess exactly the reason that that's happening, what mechanics are going on in the throat that would tell us how we can fix that.
So if you've had stroke symptoms and you went home and now, 3 months later, you're trying to adjust, but you feel like you're having coughing issues or you're having difficulty swallowing, is there something that patient should do just for the time being until they can get an appointment to be seen?
I think probably the best thing to do is to discuss with your doctor as soon as possible, even your primary care provider, and then they're usually able to schedule an appointment with a speech pathologist from that, and they might want to do just a study straight away that we would complete with the radiologist usually, and then we can tell you that day what we find.
Good, good. How do you know someone's having difficulty swallowing? So if I'm the caregiver of my spouse who's had a stroke, how do I know that maybe they're not swallowing correctly? Or even prior, maybe I don't know they've had a stroke yet, but they look like they're struggling. How do I know?
A lot of times it's coughing and choking while you're eating. So that happens to all of us once in a while. Things go down the wrong pipe. But this would be almost with every single bite. Or sometimes it more specifically happens with liquids. And then when they're eating and chewing, it might take a really long time to chew their food, or they might have food left over in their mouth when they're done chewing.
So how many patients really have these issues after a stroke? Or what's the most common that you see out of those three things, the aphasia, dysphagia, or difficulty swallowing?
So 65% of stroke patients have dysphagia, which is the difficulty swallowing. And I think that's probably the biggest impairment we see after stroke that we treat as speech therapists.
And we really look at what side of the brain was affected for the language versus the cognition piece. So if we were to group both of them, cognition and language is one and dysphagia is something else, we'd probably see more of the cognition and the language more. But since we separate them out into several different pieces, probably dysphagia is the one that if they have two things, it's usually language and swallowing issues.
Mm-hmm.
So when a possible stroke comes in, I'm assuming you guys assess for dysphagia right away. What is the process in the hospital? So say we're talking to the community, and what can they expect?
So the nurses will do a nursing screen. So that's where they go in. They look to see how your mouth is moving, how your lips are moving, how your tongue is moving. They'll give you a little sip of water to see if you'll cough with the little sip of water. If they see coughing or have any other concerns, difficulty giving you your meds, choking when you get your meds, then they will request for the speech therapist to come. Now, in the hospital, we always come and see our stroke patients and do either a language or a cognitive assessment. So if the nurse stops by and says, I'm kind of concerned about their swallowing too, they didn't cough, but something just seems kind of off, we'll do a bedside evaluation as well and go from there.
So patients can expect that when they first arrive, that they're not going to get to eat right away or drink right away because we have to assess that they're going to be swallowing correctly.
Correct.
Yes.
Okay, perfect. What else can you tell us about different speech or dysarthria or dysphagia with stroke patients?
So Hannah kind of mentioned apraxia, and one of the things that we can use, which is really neat, to help people with apraxia, so that's the difficulty with planning how to move the muscles in your face to speak. We can use an AAC device, which sometimes looks like an iPad or a phone, to help them communicate if they can't verbally communicate, so that they can still have access to friends and family, even if it's not with communication.
Yeah, and even
verbally.
if they can communicate, an AAC device really helps during those communication breakdowns where they really just can't get those words out, and it's just like a little computer screen that they have in front of them that they can just hit. This is what I'm really trying to say. So it eliminates that guessing game for both the patient and the loved one that they're trying to talk to.
Is there any helpful hints for those viewers out there that maybe have some of these issues but didn't maybe go to speech outpatient, or maybe have and now have used up their time with speech therapy? Like, are there any special utensils or apps or that would be really helpful that they could get without having to go back to see speech, or that they could use at home, just different techniques or anything?
The biggest thing that I recommend to my patients, and a lot of things that we see after a stroke when someone is having difficulty communicating, is that they really become recluse from their family members, or they kind of take away. They don't really like to go out to dinner with their friends anymore because it is really frustrating. We really encourage our patients to continue their daily lives and really continue doing those things, because the more you use it, no matter if you're coming in with us for therapy or going out, and the way you push those limits, a lot of times we see the progress that we want to see. Is if you're not using it and you're not using those skills, a lot of times it won't progress. Apps that
I think there are a lot of communication apps. I don't know that there's any one we could say right now that would be good as a general communication app, just because they're so specific. But using your phone to the fullest of its ability, you know, if typing is easier for you and it typically comes out more than when you verbalize, then just stop and type it out on your phone. Or if you have a picture of the person, you know, you're saying you're trying to recall a name and you know you have their picture in your phone, pull out your phone and show the picture if you can't get the name out.
When our patients are having cognitive issues, so really poor attention where they can't, you know, keep the conversation going or things like that. Even some of the games that you play on your computer, like let's say Candy Crush. Candy Crush is a huge game that uses a lot of attention, memory, things like that. That even just little games that are on your phone that you just play for fun, that you and I play for fun, that can really be a therapy tool at home that we encourage some of our outpatients to do, or even in the hospital do while they're sitting there in their hospital bed.
Perfect. Yeah, thank you. Anything else that you could share with us, suggestions, or maybe even share kind of what you do as small, I know it's very robust, but maybe like the different techniques you use to move your tongue, or anything that you would share when we go to the hospital when we have stroke?
Yeah. So when we're doing swallowing, there are different strategies that we teach. We would want you to be evaluated by a speech pathologist before you use these strategies. Sometimes using these strategies can lead to more harm than good. So you really do want to be evaluated, but we do things like, if you know one side is affected, sometimes if you use like a head turn to swallow, or if your tongue isn't quite moving the way that it should be, you know, using a head turn and maybe a slight head back. A chin tuck where you tuck your chin down to your chest to help protect that airway. There's several different strategies that we use, but again, if you are having something like where you can't control the water that's in your mouth and you do that, you know, head turn back, that's going to go back in your throat, causing you to choke. So that's why it's really important to get the opinion from the speech pathologist on what strategy would be the most beneficial for you. Our goal, sometimes what we have to do when someone is having difficulty swallowing, is thicken their liquids. Our goal as a speech pathologist is to find a strategy to help, you know, before we get to those thickened liquid stage, what can we do so we can keep you just on regular liquids so that you want to drink the liquids and enjoy them. What strategy can we do? If there's not a strategy that works, unfortunately, sometimes we have to go to the diet modification to softer foods, thickening the liquids to nectar, honey-thick consistency, which our patients don't love, but it does keep them safe. If they do, have it so the liquids go down the wrong way, what it can cause is something called aspiration pneumonia, which is kind of a scary thing. So it's important to follow the strategies and the recommendations that we give.
Perfect. Anything else you ladies would like to add before we end our session here today?
I don't think so.
I don't think so.
Okay. Well, thank you so much for coming. We appreciate your time and your dedication to stroke patients, and thank you for sharing all the great information.
Yeah,
Thank you
Thank
for
you.
joining today, and we hope that you have a blessed day, and we look forward to seeing you next time. For the love of you. Thank you.